Good morning, everyone. Welcome to today's live update. Today, I am joined by a new guest, Michelle Dorsonville. She's the Associate Director of the Center for Health Education and Wellness. And during this pandemic, she's been leading our isolation and quarantine support team. Welcome, Michelle, to this group. As always, I'm also here with Dr. Spencer Gregg, Director of our Student Health Center, and with Provost John Zomchik. Today, we're going to talk about three things: vaccines. We'll go over the data from this week, including our first set of community saliva testing results. And third, then Michelle is going to talk with us about isolation and quarantine support for our students. Now, before we get started, first, I want to thank our students, along with our faculty and staff, for wearing your masks. I was out and about campus, I was in the library, and I was so excited with what I saw. Everybody had their masks on. We're seeing more and more people following the guidance, but it needs to be 100%. So please, everyone, keep masking up. I told the students I saw yesterday, when you see someone without a mask, just say to them, "Hey, buddy, where's your mask? Hey, I've got an extra one. Here's a mask." There's nothing wrong in doing that, and that's how we all help one another get through this and support each other. So let's talk about vaccines. A lot of conversation about vaccines, but also some confusion. So Dr. Gregg, you're joining us today. You're over at the Student Union, I think, aren't you?
Yes.
Where our staff is actually administering vaccines to some of the eligible folks in our campus community. So, can you tell us about today's vaccine distribution? What are y'all doing? Who's getting it? How are we identifying who's eligible, and how are we contacting them?
Yes, Chancellor, it's good to be with you again today. We are
Thanks.
really excited about this opportunity today. We've partnered with the Knox County Health Department to provide COVID vaccine on campus. And in accordance with the state of Tennessee's vaccine plan for phase-related and age-appropriate vaccine distribution, we had contacted departments across campus to put together a phase-related and age-appropriate list of faculty, staff, and students in training. And then from those lists, we contacted each eligible participant by directed email, advising them of today's opportunity and providing them with a link for sign-up. Today's vaccine event is limited to university-affiliated faculty, staff, and students in training that qualifies for phases 1A1 and 1A2 of the state's vaccination plan. These are individuals who are likely to have direct patient contact or contact with potentially infectious material during the course of their daily work or training activities. Phases 1A1 and 1A2 are primarily healthcare and healthcare-related fields. Additionally, we've contacted each faculty, staff, and student over the age of 70, which is in the current age-appropriate vaccine group according to the state's plan, and we invited them to participate as well. So we're seeing all of those folks showing up here today.
That's fantastic. So, Dr. Gregg, how many doses have we actually administered today?
Well, we just started at 8 this morning with our first doses, and so far we've administered just under 300 vaccines, but we still have a way to go, and we hope to provide up to 700 vaccinations to this group by the end of today.
Wow, that's just great. So, one more question. What is our plan going forward as more of our employees become eligible to receive the vaccine? How are we working with the health department? Just how is that working?
Well, since we're new at this mass COVID vaccination effort, as with everything COVID, our plans could change. But at this
Yeah.
time, we're planning to take a similar approach with each subsequent phase and age group as we have with the event that we're currently holding here. Now, certainly, this is contingent on having vaccine available to distribute, and hopefully we'll soon see that availability increase. We also plan to coordinate some public-facing events, again in coordination with the Knox County Health Department, similar to what some of our local hospitals have been doing as well. And once we finalize those plans, we'll make that information publicly available.
That is so good. It's so encouraging. The vaccine is the light at the end of the tunnel, it feels like. So thank you so much for that information, and we will continue to keep our campus community updated as we get additional guidance from state and local health officials on the vaccine distribution. So now let's go over today's data. So Here's the data update. As of this morning, we had 103 active COVID-19 positive cases. 90 of them are students and 13 are employees. So that includes 8 new active cases just since yesterday. And you can see from those graphs the trend that's happening. And I'm just going to editorialize here a bit and say the trend we don't want to have happen is a steep spike like we had last September. So right now, let's talk about who's in quarantine and self-isolation. We now have 293 people in quarantine or self-isolation. Of those, 244 are students. And on this chart, what you see is the blue are students who are non-residential. That means they live off campus. And the green are students who live on campus. So from my eyesight, that looks like about 50-50. Right now, the gray number there is employees. Now we also have a new cluster. This is our third of the semester. And that is related to an off-campus gathering. It involves 10 positive cases and 6 close contacts. The original case was identified through our campus community saliva testing program. So Dr. Gregg, I would say evidence the testing program is working. Our contact tracing team quickly worked to identify everyone who'd been exposed, and we greatly appreciate the students' cooperation. Because of their responsiveness, we were able to limit the exposure to others and stop the spread. This is exactly how our community testing program is supposed to work. And it's why it is so important that everyone participate. We now have community testing open to commuter students, those living off campus. So I encourage you all to take advantage of this. It helps you ensure that you and those around you are safe. And it helps the broader campus community as well, which we are responsible for. We don't want to be infecting the larger community. So Dr. Gregg, I'm coming back to you again. Our cases are steadily climbing, which is not unexpected. Still, a rise in cases is never what we want to see. So what is your reaction to these numbers I just put up there?
Chancellor, while it's true this wasn't unexpected, it really remains an indicator that we've got to do a better job of avoiding exposure risks. It's still imperative that we focus on mask wearing, social distancing, and appropriate hand hygiene. Even for those who've had the vaccine, this guidance should still be followed. And we just can't overemphasize the need to, as much as possible, avoid social gatherings, especially where eating and drinking are occurring and health and safety guidance isn't being followed. That's still our most common exposure event.
Okay, so the same reminders as last semester. We've just got to be on our toes. Social events, small gatherings, stay out of restaurants and bars where you're crammed in there, and social gatherings where it's unsafe. So let's talk about our testing data. For the first time this semester, we have community testing data to share with you. So last week, we collected 4,696 samples, and 4,566 of them were from residential students. So out of the 4,600, about 100 were non-residential. And then we tested them in pools of about 5 samples each. Out of the 954 pools, we identified 14 pools and 83 individuals who were referred for diagnostic testing. So let's go through that again. That might be kind of confusing. Let me remind you. We test the saliva in pools that are about 5 samples each. So we had, as you can see on that chart, we had 954 pools. And out of that, we identified 14 pools and 83 individuals that needed to have the nasal swab. Of those who were tested, we identified 12 positive individuals, 10 residential students and 2 commuter students. Our overall participation rate for residential students was 71.2%. Our positivity rate across all of the 4,696 samples was 0.26. So that's a fourth of 1%, if I got my numbers right. So the row you're following there that I was talking from was January 30th, the totals. 12 positive diagnostic tests out of 4,696. So Dr. Greg, here I come back to you again. What is your impression of how the testing's gone so far? And what is your reaction to these numbers?
Well, I'm certainly pleased with how testing, both in our community testing efforts and through the Student Health Center, have been going. We'd like to see the best possible participation rate. So we really want to encourage both our on-campus resident students and our commuter students to participate in the saliva testing program. Of course, we also have testing for students that are symptomatic and asymptomatic through the Student Health Center. Students who are asymptomatic can schedule an appointment through the patient portal, and those that are symptomatic can reach out to our telephone triage nurse on the telephone triage line. We'd like to see those individuals that are symptomatic for an evaluation before testing. And as a reminder, we still have the Everlywell at-home collection kits available for use by faculty, staff, and students. Those are available at the Student Health Center. You don't have to have an appointment to pick one up, and they're at no charge. So we really have ample testing opportunities for people to take advantage of, and we really encourage them to do that. Obviously, as more of us are back on campus now, our testing numbers have gone up, as have the number of positive test results. But we're really pleased with the results we're seeing so far, especially with our campus positivity rate being so low. We hope to continue seeing that stay as low as it is. Less is always best in that regard.
Yeah, absolutely. Okay, so a second part of our data discussion this morning, that was about our testing and our positivity rates. I want to talk a bit about our metric summary. Now, this is a more fully developed set of metrics than we had perhaps last fall that we're looking at to help us figure out where are we and where this virus is going. So let's look at our metric summary, which is on this chart. As a reminder, this table includes all the indicators that we use to evaluate whether we need to tighten or ease temporary restrictions. There's no one indicator that would tell us that, but we look at all of them. So here on campus, our daily average for new cases over the last 7 days has been 9.6. This is down slightly over last week, where we saw about 10.4 new cases each day. We're also monitoring, so that's on campus. We're also monitoring, as that first row tells you, what's going on in Knox County. And we look at, right now, Knox County is 30 cases per 100,000 people. This is down 19% over last week. So that is saying in the county, we're doing better. That continues to be really good news for our community. Another thing we look at is the hospital ICU capacity. Remember, we talked last fall, a lot of what we're concerned about is we don't want to ever get in a situation where we're contributing to overrunning the hospitals. So right now, the hospital ICU capacity is at 16%. This is also trending in a good direction over last week. Overall capacity for adult beds remains at about 10.7%. So let's think in terms of our capacity to respond to positive cases here on campus. That has to do with our care in quarantining and isolating students. So our capacity to respond to both those groups of students, those who test positive and those who need to quarantine, remains very high. Our contact tracers are still responding to all cases within 24 hours, and our diagnostic testing at the Student Health Center has a 1.5-day turnaround. All of those are metrics that we're pleased with. We are using about 8% of our quarantine beds and about 2% of our isolation beds. With that, I really want to thank Dr. Greg for joining us today. We're going to let you get back to your work there at the clinic and vaccinating more people. So thank you so much for all your leadership, Dr. Greg.
Thank you. It was a pleasure to be with you this morning.
Okay, so now we're going to move on and talk about our isolation and quarantine support for our students. And as I mentioned at the beginning of our update, we are joined today by Michelle Dorsonville, who is handling our isolation and quarantine support for students. Since we first returned back to campus in August, we have really learned from our experiences, and we've listened to students to try to create a robust system to help our students who are having to quarantine or isolate. Michelle, can you tell us a little bit about what a student experiences from the time they find out they are either positive for COVID or have been identified as a close contact through when their quarantine period ends? So that whole continuum.
Yes, of course. So our team, the isolation and quarantine team, supports students from the moment that they are assigned to a location until they are back to their permanent residence hall. We know that having to relocate can be stressful, so we call students very shortly after they receive their location assignment to help them prepare to move. We also help students coordinate transportation and meals if they need them. Now, once a student has settled into their assigned location, we continue to call and text students throughout the duration of their isolation or quarantine period for check-ins. These check-ins are important. During these check-ins, we want to make sure that the student is doing well, physically, emotionally, and academically. If a student needs any additional support for those areas, we make appropriate referrals to our campus partners. Now, we do a lot of the outreach to our students by calling and texting, but students can also call and text us. We are here for them 7 days a week if they have any questions or concerns that they want to share with us about their experience.
Oh, thank you. That's great news. So here's another question. Tell us a little bit about Massey Hall and what it's like for students who choose to go there because they've tested positive and they need to isolate.
Right. As you've just said, Massey Hall is the location for all students who have received a positive COVID test result. Even though all students assigned to Massey are isolating, they do not have to isolate in their rooms. Being social is encouraged and helpful to students' mental health during this time. Massey has really great amenities, including an exercise room, pool table, ping pong table, cornhole, and a TV lounge on each floor. Meals are delivered to Massey, but there's also a free pod market on the first floor for students who may want a snack or drink in between their meals. And on top of all of that, there's an outdoor courtyard exclusively for students who are living in Massey so that they can get some fresh air. And once the weather warms up, we hope to host movie nights outdoors for fun socialization.
Yeah, so and you point out there another important thing to remember is if you've tested positive, you can be around other people who've tested positive if you feel like it. And so Massey has, as you just mentioned, a number of opportunities for socializing and being with other people. So here's one last question. Michelle, you've had a chance to interact with a lot of students who've been in isolation. That's if you've tested positive, or quarantine. That's if you are a close contact but not positive. What do they tell you about their experiences? And what advice do you have for students who are entering quarantine?
It's a great question. I would encourage all students who may find themselves entering quarantine or isolation to remember that it's a temporary situation. It can be stressful, but our students are resilient. They have developed stress coping skills, and those skills will help them get through quarantine. Remembering that it's a temporary situation helps make it a little bit more manageable. We've had students come out of quarantine with unexpected benefits, such as making new friends, which is awesome. So even though it can be stressful, it's temporary, and we're here to support them through it.
Oh, that's great to know. So, as Michelle mentioned, academic support is a big part of the network of resources and the help that we provide to students in isolation and quarantine. As she mentioned, we call every day to see how students are doing, and that might be a point at which someone might say, well, I need some academic support. So I'm going to switch to Dr. Zomchik, our provost. What does that academic support look like for students?
Thank you, Chancellor. As Michelle was saying, we want to do everything that we can to help students socially, but also academically. So our Academic Success Center, our Student Success Center, gets notification from our isolation and quarantine team about the students who have to isolate or quarantine. And when they get that notice, they reach out to the students in order to provide support. Now, that same team will also let the students, faculty members know that those students have a legitimate excuse for not being in class. They don't reveal any personal information or private health information. They simply report that these students have a legitimate excuse for not being in class. Then what they do is our academic coaches reach out to the students and find out exactly what kind of help they might need while they're isolating. It could be help with developing effective study habits. And as Michelle was saying, they can accrue these benefits and carry them with them when they leave isolation or quarantine. They can get help managing their time. They can get help preparing for tests or other forms of assessment. So basically, we want to do all that we can to make sure that the students who are in isolation or quarantine have the support that they need. We know, just as Michelle was saying, that that situation can be stressful. So whatever we can do to help alleviate some of the academic stress, we're on it. We got a terrific team in our Student Success Center. But I also want to just sort of support and give a shout out to the Student Success Center, because the services that we provide, the kind of concierge services that we provide for those in isolation and quarantine, are available to all of our students. So whether you're isolating or not, reach out to us. We're here for you. We want you to succeed.
Thank you so much. If I could just summarize what I think we've heard today, it is we're set up and ready to go with vaccines as soon as we get dosages, and as soon as our populations on campus reach the age level or the priority group. Dr. Greg talked about that and left to go back to be giving more vaccines. We also talked about the fact that our testing is showing that our participation rate is going up. I want to keep asking the students in the dorms to make sure you're participating in that. We're at 71%. We need to get that closer to 90. So keep going. Thank you for that. But the testing we're doing is helping us isolate these clusters early and stop other students from it spreading. And so that's really fantastic. Our positivity rate is less than 1%, not even a half of 1%. So that's great. The other thing that you heard, was so nice having you, Michelle, on here this morning. I hope everyone can just sense the feel of comfort and support that Michelle, even just her presence here, it permeates throughout the support that we're providing students in quarantine and isolation. And actually, we're having students telling us it wasn't that bad. I made a few new friends, and I heard one student tell me I actually caught up on a lot of my studies when I had to quarantine. So there are positive ways to look at it. And then finally, Provost Zomchik has reminded us that we have tremendous academic support for our students, especially in the time of COVID. So I want to thank everyone for being on this Zoom this morning. Thank you to those of you who are going to watch it later. Thank you, Michelle, Dr. Greg, Dr. Zomchik for being here, and to all of you for tuning in. So until this time next week, I hope everyone has a safe and happy week in the coming days. Thank you all.